With its steep hills and terraced cottages, the South Wales valleys are unique. You won't find this anywhere else in the world. But these communities stand out for another reason. They have the highest COVID death rates in the country. In Mountain Ash in the Cynon Valley, it's on everyone's mind.
I know quite a few people that have had it. Some have got over it, the younger ones, some have got over it quicker than others. Everybody's worried. Look at the town. It's terrible.
Howell's clothes shop has been here for decades. It's surviving with a click and collect service.
A couple of members of my family have had COVID, but fortunately none of them to a very bad degree, and they've come through it.
It seems to be one of those places where everyone you talk to will know someone who's had COVID.
Very much so, especially now. It wasn't in the beginning, but very much so now.
Andrew Morgan is the leader of Rhondda Cynon Taf Council. He looks at the numbers and the trends, but he's also a local lad.
I know of two family friends, both not that old, one in their 50s, one in early 60s, both relatively fit and well, and sadly both died before Christmas. I lost a relative Christmas week, and last week I lost another two relatives. So I can identify 5 people quite well who passed away in the last couple of months. Our burial services had to expand to keep up in Rhondda Cynon Taf. So we've had to introduce extra times at our crematorium because on a couple of occasions we wouldn't have been able to cope with the normal hours that we operate.
It seems everyone you speak to in Mountain Ash knows someone who's had coronavirus. The question is why? Why have the South Wales valleys been so badly affected? Some think part of the answer could be how close the houses are to each other.
If you look at the streets in the valleys, the front doors are not 2 meters apart, are they? You know, if Mrs. Jones comes out of her front door, she's not 2 meters apart from Mrs. Davis if she comes out of her front door.
But there's more to it than that, according to Professor Kerry Phillips, an expert in health economics. I caught up with him while sheltering from the rain.
What I think is evident is that in the valley communities, there's an underlying poor health. What COVID has done has exaggerated that, and it's likely to make those inequalities even greater.
How long do you think it'll take for the valleys to recover from this?
So I think it'll take at least a decade for the valleys to recover, both mental health and economically. Town centres will definitely need more support, more investment, more ways of trying to diversify. But I think that the community, while they've rallied round supporting each other, you know, we had the floods in Rhondda Cynon Taf, then we had the pandemic, but ultimately, while they've come together and support each other, I think after the pandemic's over, we may see sustained mental health issues. Now we've seen almost a doubling of the suicide rate in our area. That is something going forward that we need to address. I know there's more money being announced in particular for young people, but it's affecting people of all ages.
The valleys were beginning to stand up again, having been on their knees for years. Tourists were flocking to the area, and now the pandemic. It seems particularly cruel, but then cruelty is the characteristic of the coronavirus. Rob Osborne, ITV News, in Mountain Ash.